Hello everyone, my name is Hunter Sellers and I am one of the second year radiology residents at the University of Texas Health Science Center at Houston, and I'm here to talk about a project we worked on at one of our outpatient imaging facilities where we assessed the clinical benefits of discontinuing pre-screening kidney function tests for MRI exams requiring contrast. The standard practice for patients getting an MRI exam with contrast has been to pre-screen kidney function due to the risk of nephrogenic systemic fibrosis with gadolinium-based contrast agents. However, since Group 2 agents were introduced as the primary source of contrast, we have learned that the inherent risk of NSF is very low to non-existent, regardless of underlying kidney function. Because of this, pre-screening patients for kidney function prior to receiving contrast is theoretically unnecessary. At our facility, we wanted to evaluate the clinical appropriateness and potential benefits of discontinuing this pre-screening test for all patients without a documented history of kidney disease. The aim for our project was to enhance the patient's experience at our facility by getting rid of an unnecessary needle stick and the cost of the test of the patient. We also hope to decrease the total daily time spent performing these tests by at least 45 minutes, and that this time saved could then be utilized to schedule an extra MRI exam per day. Our intervention, which is based on available literature and national guidelines, is that on November 30th, 2020, our outpatient facility stopped administering pre-screening kidney function tests, or ISTATs, on all patients, with the exception for those with a documented history of kidney disease, and we looked at the total number of ISTAT tests done per day for 1 month before and 1 month after November 30th. The total time spent per day administering these tests was calculated to see how much time has been saved since this implementation. Looking at all of the MRI exams with contrast performed per day for 1 month prior to November 30th and 1 month after, we saw that an average of 8 ISTAT tests per day were done before compared to 1 day after we changed our policy, coming out to be a nearly 88% decrease in unnecessary needle sticks for patients. Speaking with multiple nurses and technologists, the average time to perform this test is about 10 minutes, coming out to be around 80 minutes per day that was used to spend on this test compared to 10 minutes now, resulting in a 70-minute per day time save. The average MRI at our facility takes 45 minutes to complete, so with this new 70-minute time save, we have been able to schedule an extra MRI per day, and the amount we are able to bill for an exam is $3,832.50, and this is our theoretical amount brought in per month and on a per-year basis. Additionally, we looked at how many ISTAT tests were required to order on a month-by-month basis before and after November 30th, coming out to be 100 tests ordered before and 25 tests per month ordered after, with each test kit costing $6.25. This is our savings on a per month and per year basis. So in conclusion, since this implementation, the overall patient experience has been improved as they have one less needle stick and do not have to incur the cost of the test. With the decrease in ISTAT tests performed daily, we now use this allotted time to add an average of 1 additional MRI scan per day, increasing the overall revenue to the system. And finally, we have decreased the money spent on the test, thus enhancing cost containment. Thank you for your time.